On the occasion of the 73rd birthday of the National Health Service that was set up by Prime Minister Clement Attlee's Minister for Labour, Aneurin Bevan, on 5 July 1948, the NHS Chief Executive Sir Simon Stevens paid tribute to this wonderful organization at St. Paul's yesterday and commended them for their dedicated service. He said, and I quote, "An inspiring example for our own generation of how out of adversity can come strength." This is wonderful. They deserve every commendation they get, every praise they get. The NHS, from consultants, registrars, medics, juniors, nurses, porters, receptionists, everybody who works at the NHS has been working full steam over the past 15, 16 months as we have faced the challenging ravages of COVID pandemic. But saying wonderful words, or for that matter, when we used to stand outside our doors and clap for the NHS or light candles for the NHS. They're nice symbolic gestures, but they're not enough. Plaudits aren't enough. I saw on social media some of the NHS workers saying exactly that. And one of them said it very plainly, said, "Wonderful, clap, light candles, feed us nice words and high praise, but 1% pay rise? Ridiculous." After what they've been through, the NHS staff, the personnel, really 1% is nothing short of an insult. Okay, we don't have much money. The coffers have emptied out considerably. But having said that, there are priorities. The NHS has, in my books, in my esteem, more priority than a royal yacht. And it is important that we show our support for the NHS in ways that make these people earn more money, get a better pay rise, manage to live more decently, more comfortably, more easily. And of course, you might then turn and say, yes, but if we start making exceptions for the NHS because they've been wonderful, what about transport people? What about education people? After all, the three key coffers, public coffers at the moment that are impacted by the pandemic are indeed education with schools and universities, transport with all the passengers who've deserted our national railways and buses, and of course the health. Yes, that is an argument, but that argument becomes an excuse if we don't say, okay, this is true, what do we do about it? And you know what? At the risk of irritating some people who would disagree with this approach, I would say, yes, think of taxes. We've discussed this before on many an occasion. Do you remember when we used to say, what if we have a special tax dedicated for this or for that? Isn't it time now to do something to show appreciation? I leave that for you to think about and reach your own conclusions, draw your own conclusions. But I now move on to the second part of the short YouTube, arm wrestling with COVID-19 in London. And today, as you might have realized, is my number 49. So from plaudits and nice words and nice candles and clapping, I come to something else, which is as important, if not more important in some sense. And that is the easing of lockdown, the removal of most of the final restrictions that we had to abide with. Now, if I understand correctly, in a nutshell, responsibility is now being passed from government onto us as organizations and as individuals. I listened to the Prime Minister at his press conference yesterday, flanked by the Chief Science Officer, the Chief Medical Officer, and the two Union Jacks. I also heard this morning on the BBC Radio 4 Today program, Sajid Javid, our new Minister of Health, waxing lyrical, almost, I'm exaggerating a tiny bit, about the merits of removing the restrictions. Fine. But there should be a quid pro quo. Cases are increasing. There are some 25,000 cases daily now. We were told by the time these new unrestricted times arrive by the 19th of July, we would have some 50,000 cases daily. There are some 300 admissions into hospital, thankfully a low number daily, but that might increase to about 1,000 soon. The Delta variant that we're thinking of now has spawned into Delta plus or Epsilon variants. All this is happening on our watch, on the watch of our Prime Minister. And we are easing restrictions without a quid pro quo. Just turning around and said, no, it's the responsibility of the transport people, it's the responsibility of the school teachers, it's the responsibility of individuals living wherever, for them to decide what to do with the lockdown, how to abide by it. Is that really sensible? I don't think so. I am not saying that we should be wedded to the restrictions. I'm not saying that we should go, as the Prime Minister said, if not now, when? Winter, next year? No. We can ease further the restrictions, but when we ease those restrictions, when we ease the lockdown, we have to put in its place to propose a partnership. We have to show support. We have to put support structures. Look at the United States. They're also easing the lockdown, but they are helping so much. They're putting ventilators in schools. They're showing the support that government alone can bring in such a situation in order to help us individuals to take those actions, to listen to what is being said, and perhaps to follow what we're being told. I was struck, for instance, by the fact that amongst the many unrestricted spaces that we will have after the 19th of July, that it's no longer mandatory to wear face masks, be that in public, outside when you're walking in the park or on the high street, or when you're in a crowded bus or in a crowded train. But you use your individual assessment, your own responsibility to decide whether you should wear that face mask or not. Really? That argument for me is bollocks. It doesn't make sense because individual decisions are subjective. They're not objective. When somebody decides that I don't want to wear a mask because I don't feel I need it, it becomes subjective. The person is not thinking that the primary function of the face mask actually that I wear or you might wear is not to protect yourself, it's to protect the other. And when the other wears a face mask, it is to protect you. So it's an inverse equation that is taking place there. And somebody, a young person who's more combative or more risk taking or whatever, or a bullshit person or somebody who says, no, I don't believe in any of this claptrap. I'm not going to wear a face mask. I've said it since day one. Well, I would like to see all those MPs coming to Westminster, to the House of Commons and to the House of Lords, sitting next to each other, cheek by jowl, without wearing face masks. I'd like to see what happens when people go into those buses, and believe you me, they're already crowded now, or into the carriages, and not wear masks. Individual decisions or individual assessments should be countervailed by community rights. And that, I think, what is lacking, sorely lacking in the Prime Minister's assessment, which is almost like, you know what, we've done this for 15 months. I didn't want it from day one. I had to do it because, well, it was inevitable, but I want to finish with this whole palaver, and you guys do what you want. It becomes like a free market. It's a liberal market. You decide how you want to work, and the market forces, in this case, health forces, personal choices, take over. If that is the case, if, as one minister was saying, I don't know which one it was, who was saying, well, we're not a nanny state. Our citizens should be able to make their individual decisions and not be guided or dictated upon, rather, by government and by officialdom. I thought to myself, so basically any decision I do, whether I pay taxes or don't pay taxes, whether I do this or don't do that, is my own decision. The government has nothing to do with it. Is that an analogy that works? I don't know. These are just thoughts that are rumbling, more like mumbling in my head. No wonder then, no wonder really, that England's chief medical officer, Professor Chris Whitty, the poor man who was harassed in the park, he said very plainly, any indoor situation where it is crowded, I shall wear a mask. Anywhere when it is required by a competent authority, I shall wear a mask. And if someone else is feeling uncomfortable, and this is the iffiest, the dodgiest of all three, because some people might not take this on board, if someone else is feeling uncomfortable, I should wear a mask, and I shall wear a mask too. And it was very interesting. I mean, we think that we are driven by science, not data. I tell you, the scientists were very uncomfortable yesterday when the government and the Prime Minister and his coterie of ministers were out there suddenly changing the whole narrative. And now from obeying, we have become a whole country of entrepreneurs, health entrepreneurs. It's dangerous because we are riding on the crest of another wave. And whether that crest, it's a bit of a contradiction of terms, but if you'll allow it for the moment, that if that crest goes further up, when do we say enough is enough? When do we decide that enough cases are being introduced into hospitals, admitted to hospitals? When are enough deaths enough? That's my question. So let's praise the NHS, but let's also practically sacrifice something. I will sacrifice 2 pints of my favorite draft Guinness daily, weekly, monthly, so many, in order to contribute that money for the NHS and its sustenance and for public service in general. Would you do the same? I don't know. Maybe you think it's unnecessary. Maybe you think that Clement Attlee's idea of the NHS was an inspiration that has run its course. I don't know. Up to you. And also, when we talk about exercising individual decisions or individual rights, when we decide, do we wear a mask or not? Do we go out or not? Do we go here? Do we do this? Do we do that? When the government starts suddenly turning a 90-degree course in order to justify its new economic narrative, let's pause for a minute and think about the human narrative as well. A final thought I'd leave with you, and then I'll conclude, I promise. Keep watch of something called black fungus. Medically, it's called mucormycosis, which is a fungal infection that attacks the eyes, the sinuses, in other words, the nose, the lung, and the brain. And it's due to a drop in immunity. And mucormycosis, or black fungus, has been detected in India in patients who have suffered COVID. So it's something between COVID and long COVID, I suspect. And it is very, very difficult to treat. So let's keep our fingers crossed on that. Let's also keep our fingers crossed that the idea of a booster jab with our flu jab, for those who do not believe that jabs are a conspiracy, that we would be able to have those booster jabs. I've already mentioned this to my wonderful GP. I told him the other day, by the way, is that happening in September, October? Will I have a flu jab in one arm and the booster jab in the other? He smiled. He said, that's what I think will happen, but we haven't got the instructions yet. Fair enough. So let's keep all this in mind. And as we do, I'll conclude with a Latin expression. You know, I like to show off in Latin. Yeah, it's showing off, basically. I did so many years of Latin, I might as well use it since it's almost an extinct language. Mens sana in corpore sano. It means, usually translated as a healthy mind in a healthy body. This phrase, by the way, is also widely used in sporting as well as educational contexts to express the theory that practical exercise is an important and essential part of mental and psychological well-being. So, I conclude with the most natural way of walking out of this 49th episode. I wish Gareth Southgate and the Three Lions team good luck in their game with Denmark at Wembley tomorrow. That's yet another obstacle before we come to the ultimate prize. They've been doing so well. Let's hope it continues tomorrow. And I wish you patience, I wish you forbearance, but please think before you act. We are still not out of the pandemic.